So good morning or good afternoon to all of you. Very happy to have you with us for the second International Experts Forum on Policy Dialogue workshop, which is specifically on the topic of tailored healthcare through happy living. So we look today into personalized medicine initiatives and how personalized medicine transforms our health systems. So we have very nice international initiatives with us, great speakers. I'm very happy to welcome you all to this session. And let me start with a very quick, say, administrative overview. If you can move to the next slide, please. Just to make sure that you're aware, so this webinar is being recorded, so we can make it available to more interested persons afterwards. I wanted to please ask you to also switch off your microphone if you're not speaking, because this creates some background noise. And of course, for the participants, if you have any questions, please feel free to use the chat. We're transmitting these questions to the different speakers, and we have several question and answer sessions where we'll, of course, come back to the questions. And then a very important information, this webinar is actually co-organized with some Chinese colleagues, and we're providing simultaneous translation between English and Chinese. So if you wish, please switch on the interpretation button, which is on the bottom of your bar. It's called interpretation, and you can select the language from the bottom. All the speakers will be speaking in English, but we might have questions in Chinese, so that is why it might be relevant also for you to select the language. Okay, so then let me start with our first session, which is about setting the scene. So we start with a short presentation of Enrich Global as co-organizer. Next slide, please. And we wish to introduce to you the Enrich Global Health Innovation Thematic Group and the International Expert Forum for Health Innovation that we have set up in this group. I'm Eva Fadil from GSC Group, but representing today Enrich Global Thematic Group of Health, and I'm with Matilde de Bonis from ACRE. Next slide, please. So what is the Enrich Global Health Innovation Thematic Group, and what's our forum? So let me start with shortly introducing Enrich Global, which is a non-for-profit member-driven association created 3 years ago. We have a couple of public and private organizations which are our members from around the world, in Europe and other countries in the world. And the network is a contributory initiative where all the members provide inputs through different means. The idea is to really take European innovation global and vice versa, to connect innovators from Europe and from the world, and to make sure that we have a very nice international cooperation ongoing. Next slide, please. In Enrich Global, we have several thematic groups, which are the pillars through which we are cooperating with the different members. And each group has a different objective or different setup. You can see here on this slide the different groups we currently have. For example, one is on digital innovation, one is on foresight and innovation management, on internationalization, science diplomacy, and so on. And as I said, we are here today with the Health Innovation Thematic Group, which is organizing this webinar together with our other initiatives. Next slide, please. So the Health Innovation Thematic Group has as an objective to foster the international cooperation and the policy dialogue on global health issues. It has built up a very nice group of experts, a community of international experts in our International Experts Forum, and we have currently more than 600 stakeholders involved, which have agreed to cooperate internationally, and they're very glad to have many of you today in this webinar. So these experts come from very different groups. We have researchers, company representatives, care providers, also representatives from associations which represent patients or users, and so on. And we have also policymakers and public authorities, funding agencies, which are working on the field of health. So in this expert forum, we have a lot of stakeholders which can connect among themselves and connect with us. So we try to enhance cooperation between the different stakeholders, and we do this through different activities, in particular through this annual workshop that we're organizing and which you're in today. Next slide, please. So I wanted to give you a very quick glance on what we did last year, because it's actually very closely related to our today's workshop. We had our first International Experts Forum and Policy Dialogue workshop, which was about personalized medicine approaches to active and healthy living and aging. And we had renowned speakers from around the world, from Europe, from Latin America, China, South Korea, USA, and Japan, which presented their initiatives or their organizations and how they work on personalized medicine and international cooperation. And we had very interesting insights. We had some 90 participants from our health innovation community with us, and I'm glad to see that many of you are still with us for today. Next slide, please. So within this workshop last year, we did actually some interactive session where we asked also questions to the audience, and one was about the definition of personalized medicine. And one question, which you can see here on the slide, was about the question of which aspects of personalized medicine are the most important for active and healthy aging and living. And you can see here in the bird cloud the different birds that have appeared. And you can see those which have been mentioned the most often, which are in bold. And as you see, it's tailoring approaches, and it is prevention, among many others, of course, as you can see in the word cloud. So this is actually interesting, because we have used this as a basis to define today's workshop topics and focus, because we thought that it was very interesting to build on this first workshop and to have some continuation for you. So this is why today's workshop is about the topic of that we have named through tailored healthcare to healthy living, how personalized medicine transforms our health systems. So you can see, or we hope that this answers also some of the questions that have been raised last year about the tailoring approaches and the prevention aspects. And obviously, the international component is always a part of our main focus area. So let me give you an overview on the next slide, please, on what we do today. So we're very glad today that we are cooperating with several interesting initiatives, which are the IC2PREMAT project and the PROPHET project. Both are EU-funded projects, and IC2PREMAT is also cooperation with China. So it's about integrating China in the International Consortium for Personalized Medicine, an EU-wide and now worldwide initiative where personalized medicine is in the focus. And in the PROPHET project, the main aim is to create a personalized prevention roadmap for the future of healthcare. And we will have presentations from both initiatives in the second and the third session today, with a very interesting insight, which will be shared through the different experts. Exactly. So thank you very much. This is the agenda of today. Just a glimpse. I will introduce the different speakers when we come to the different sessions and speaking slots. So we have 3 sessions. The first one now, we will continue just a little bit on the Enrich Global Health Thematic Group, and have done speakers from which are where we are discussing transformation of healthcare systems. And we have an overview from the European Partnership for Personalized Medicine, EP-PREMAT. Then we are moving to the second session, which is organized by the IC2PREMAT initiative. You will have very interesting insights from the coordinating team and from our Chinese cooperation partners. I'll introduce all of them, of course, when we come to this session. And the third session is towards a personalized prevention roadmap in Europe, organized by the PROPHET project, as I mentioned before. So thanks a lot to all of you to be with us. So very quickly, just some last words about Enrich Global and especially about our health innovation community. So as I mentioned, we are having a 600 and more persons stakeholders community for the moment, and we're very glad to announce to you that we're actually changing the interface of the platform that we're using to interact with you. So we have had a digital platform which allowed us to communicate to you and allowed you to also exchange with your peers. And now we are actually moving to a more sophisticated digital tool, which hopefully will allow us to collaborate even further. So we see this as a great opportunity to connect within the community, but also to connect to other communities, because this platform is being set up for other communities as well, communities working on other thematic topics, such as digital or environmental aspects. And we have already had the feedback that some of you are interested in these other topics, because there can be, of course, close connections between health and digital and health and environmental issues. So you will have the opportunity to also connect with these other communities over time. So next slide, please. This Enrich Global platform will enable us to enhance our e-community, to widen it across regions, sectors, thematics. We'll have a lot of different project initiators cooperating with us. I'm sure it will become a very nice interactive tool. And we're trying to provide you a lot of different features that can be beneficial to you for our health community and, of course, beyond this one. We aim to set up networking opportunities through these different tools. So here's a quick glimpse at what is coming on this new platform. So we will have a user profile for you for each community, and you can, of course, connect to all those which meet your interest. We will organize webinars such as the one today, where we make sure to invite experts from different initiatives, from different international background, to enhance the exchange of knowledge and to make sure that there's an ongoing discussion and collaboration. We will make sure also to communicate to you when you're part of these communities, share information. You will have the possibility to suggest topics, to share information with the whole community. And of course, we will have some cross-community features, as I mentioned. So we will have the possibility to communicate also with other communities from other thematic backgrounds. Sorry, please go back to the, yes. Some of these features will be available over time. For example, we will have matchmaking opportunities where you can meet bilaterally with experts from around the world. You will have a virtual fair coming up next year where companies can promote themselves. We will have a mapping tool and so on. So we will have a lot of different features which will become available over time. And of course, when something new is available, we will make sure to communicate this to you. But in order to receive these communications, you have to make sure that you're confirming that you wish to be part of this health innovation community. Those of you who have done it through your registration to this webinar are already confirmed in the community, so that's great, perfect from that side. And those who now realize that they have actually forgotten to tick the relevant button, please make sure to communicate to us, and we'll be happy to integrate you into the community. So you will receive all the necessary communications through our communication system, and we will make sure that we inform you about anything that's going on and the different features that are available for you. And just a side note, for those who have been in the community before, please be sure that with regards to data processing, nothing is changing. So of course, we are respecting all the different regulations which are in place, and Enrich Global is still the one processing the data for the health innovation community as it has been before. We're just changing the interface of the digital platform we are using. Next slide, please. So what's next? So today we're in this workshop, and we aim to have several workshops upcoming. Of course, we're organizing this annually now. In beginning of next year, we will launch the new platform interface, and we will, of course, make sure to inform you about this. And then we hope to have you continuously involved in this health expert community. So as I said, make sure that you reconfirm your willingness. Because of data protection, we need to have this reconfirmation, even for those who have already been part of the community before. We will make sure to send all the notifications to the members, but please, if you have any questions, feel free to reach out to us either now in the chat or of course afterwards. So thank you. Next slide, please. So now we're moving to a short interaction with you, and I'm passing the floor to Mathilde Bonis from APRE, who will be sharing with us a Slido. Mathilde, the floor is yours, please.
Thank you very much, Eva, and hello everyone also from my side. And APRE, the Agency for the Promotion of European Research, that is co-leading with the GAC group, this Enrich Global Health Innovation Group. And I'm going to share my screen actually, because we are going to connect to Slido. Please tell me if you see now the QR code and my screen.
Not now.
Not yet, no.
Not yet, okay. Just a few seconds.
So we invite you all to please connect to the Slido, either through the QR code or
Yes.
through the URLs.
I guess now it's working.
Yes.
Yes, very well.
Okay, perfect. So today, our first intention is to know you better. So we would like to see who is the audience today for this event. So we are asking you to connect to slido.com and to enter the code Enrich Health with E and H as capital letters, but you have also here the QR code. So I see participants connecting. Just we'll wait for a few seconds. Our first question to you is, which country are you based in? Eva, please tell me if the people now responding are actually the number of people is in line with the participants in the event, and tell me if when I can go to the next question.
Yes, I see that people are still writing, so let's give them another short moment, but we have great representation from a lot of countries, as I see. Different countries in Europe, but also, of course, from China.
In China, yeah.
Australia, even. Great. Yeah, I think we can maybe move to the next one.
Yeah. The second question is about your organization.
Please feel free to continue answering if you haven't done it so far. Very nice representation from industry, but also academic university background, associations, networks, a couple of policy-related participants. Very nice. Okay, maybe we can move to the next one.
Yeah. Okay, now it's important for us to see if you are involved in a project or in an initiative at European or international level that may deal with health innovation. So actually, 77% of the audience today declares to be engaged in a project or initiative that is relevant for health innovation. So this is an important data for us. also to better engage and animate our community of experts and professionals in health innovation. So just few seconds to let all respond to this multiple choice, and then we go to the next one, asking those who replied yes, actually, which is the name, or if you like the website and acronym of your project and initiative. And this will be important for us to make liaison with your projects, and in some cases explore potential synergies with our health innovation community. So I see a lot of initiatives mentioned here, besides those represented today by the speakers in this event. Eva, would you like to
Yes,
add something?
Yeah, no, it's great to see all these initiatives. I'm happy to have all these representatives with us. I suggest we move back to the presentation.
Yes, I will interrupt my sharing, and let's come back to the PowerPoint. Goodbye from my side.
Thank you very much, Matilda. Great to have this interaction. So what Xenia is setting up the slides again. So let me introduce actually the upcoming session to you. We will have a presentation about the opportunities for cooperation on personalized medicine in Horizon Europe and the approach to personalized medicine and prevention in the EU partnership THCS, which stands for Transforming Healthcare Systems. And this will be presented through Katerina Bonocora, who is the Horizon Europe NCP for Health Infrastructures and GRC at APRA, who is doing an interview with Chiara Ciccarelli, and I'm passing the floor to you. Very happy to have you with us. Thank you.
Good morning to all this international community. Thank you for also sharing my slide and taking care of it. Yes, I am the national contact point for cluster health in Horizon Europe, to contextualize a bit my presence here today. And I will give I would say, very brief introduction on what European Commission and DG Research, especially an innovation from European Commission, is doing to support personalized medicine research. First point I would like to mention is that personalized medicine has received an increasing effort and increasing support in this last decade in terms of funding. And there have been several initiatives that I will show you in my slides to support and stimulate the use and the research on personalized medicine. So this is the very first important point: increasing presence of personalized medicine in the program, in the programs that the European Commission is launching. And there is indeed available funding for this. So next slide, please. This is the very, I hope, known structure of Horizon Europe that we are always introducing as national contact point. So this is also for the international colleagues present today. Little reminder, we have 3 pillars. So personalized medicine will receive opportunities for research, either in pillar 1, excellent science, where generally we have more opportunities for very basic research on personalized medicine. Pillar 2, where you see the different cluster, of which the first one is health, where the most of personalized medicine research is focused, both with collaborative research project, with coordination and support action that we will have later also intervening today, several of them, and with partnership, European partnership that today are also a very big stakeholder in on this webinar. Pillar 3 is called Innovative Europe, is really dedicated to the research which is closer to the market. So project for companies, startups, dealing with personalized medicine could be submitted there. So this is a very broad overview of the 3 pillars and the opportunities which are can be everywhere for personalized medicine. Next slide. A definition of personalized medicine. This is what European Commission since 2015 has put forward. So medical model using characterization of individuals, phenotypes and genotypes for tailoring the right therapeutic strategy for the right person at the right time, and or to determine the predisposition to disease and or to deliver timely and targeted prevention. Prevention today is also a focus of the workshop about happy living. And so this is important to consider the definition that European Commission is using in then drafting the calls for Horizon Europe. Next slide, to show that there is from European Commission side or still now political push on personalized medicine with different funding sources. So not only the research and innovation framework program, which is now Horizon Europe, but also with the previous IMI, Innovative Medicine Initiative, and the actual Innovative Health Initiative public-private partnership that I will mention also later. EU for Health is another big program that European Commission has launched, and also there are opportunities for supporting personalized medicine research and also implementation actions. Digital Europe, once again, another program which is containing some calls supporting personalized medicine approach. European Commission has put forward a lot of cooperation initiative to to bring together international actors, not only European, but also indeed extra-European, with the 1 Million Genome Initiative, the International Consortium on Personalized Medicine, ICPermed, which is at the moment really a flagship initiative for funding this type of research. But also at European Union level, there are a lot of legislative actions now in place supporting this this switch from research to the implementation of personalized medicine action, because we have been funding a lot of projects on this type of intervention, but now, as you see in this slide, the uptake of this intervention of personalized medicine could be actually faster. So a lot of Data Governance Act, European Health Data Space as an initiative is really strong at the moment. Artificial Intelligence Act, Cybersecurity Act. There is a lot of legislative process ongoing. Next slide. To confirm that also the different council presidencies at European level have put the personalized medicine in the spotlight. So this year there was a conference in June under the Swedish presidency on the era of personalized medicine. Under the Spanish presidency, another event in October on genomics-based health strategies. And there is one probable upcoming event in January on the convergence of technologies enabling RNI for the healthcare of the future. There is a TBC, but it's an upcoming event that eventually you can decide to attend virtually. The next slide is to give a background of what you will hear also today. Many coordination support action have been funded by European Commission since 2014. The first one was CSA per med, and continuing with, you see in gray, all these projects which have been creating the community, the international community of stakeholder now for the personalized medicine approach. You recognize several of the project targeting also China, EULAC, the Latin America and Caribbean region, the African one. So European Commission has decided to map and to stimulate the coordination of different actors around the globe on a personalized medicine approach, indeed to support the implementation of personalized medicine research in the beginning. And now, next slide. Everything has, of course, gone through the partnership that you will hear later, but still for supporting research topic on the personalized medicine field, you see that cluster health, especially, which I showed in the second pillar, is putting forward different topics dedicated to personalized medicine. But you see that the first choice in 2021 was to have a roadmap on personalized prevention, which will be also presented today, I think, by the Prophet speaker. Next slide. More topics in the cluster health on destination 3. As you know, the different clusters are divided in destinations, and this one has had a focus on infectious disease, because in the topic of infectious disease, it's very important, the personalization of the medicine. And also here, different project has been funded. Next one, giving a glimpse on topics 2024. So these are topics which are at the moment under evaluation, because they are two-stage type of topics. As you see, again, personalized prevention of non-communicable diseases, addressing areas of unmet needs using multiple data sources. So there are different projects under evaluation. Some of them will go through and will submit on the 11th of April an entire proposal. Next slide on topics for 2024. Yes, another click so that we see the topics. These are the topics which are actually totally open for submission for the deadline 11th of April 2024. This is to show indeed to this international audience that there are still possibilities for doing research, in this case also on the topic of preparedness and response to pandemic. Next slide. This is a recap of all the initiatives that are funding personalized medicine, have funded in the past and will fund in the future. As I mentioned, Innovative Health Initiative is also one of those who at the moment has some topics under preparation. I suggest you to look on their website on call 6 and 7 for IHI under, I would say, preparation. They are not out yet, but they are there to be consulted by the international community. Missions also are, of course, offering opportunities for personalized medicine approach for cancer research. Also there are no calls at the moment out, but a new work program will be published, we hope, by February, March 2024. So upcoming also there. And this last line on personalized medicine partnership, IC per med, which we will intervene later, is also give me the opportunity now to introduce the coordinator of another partnership, actually dedicated to healthcare system, transforming healthcare system is the name. We have invited the person working on the management and coordination of this project, Ms. Chiara Ceccarelli, because we thought that side by side to this initiative, IC PerMed, here PerMed, these other partnership could offer also an opportunity in the future, in the coming 6 years of duration. This partnership could give actually a push to support the implementation of personalized medicine intervention. It started actually 1 year ago, and it has already issued one call, but Ms. Ceccarelli could introduce the partnership to us briefly. Just mention what this partnership is going to do in terms of personalized medicine support in the future years. So thank you for the attention. You could, I would ask indeed to now switch the presentation, just giving you one, yeah, thank you. So
Yeah, thank you very much,
Chiara.
Caterina. We have 5 minutes in the slot left.
Okay, so 5 minutes left, and Chiara, thank you for introducing us the topic of
Good morning, Caterina.
THCS.
Good morning, everyone, and thank you for inviting me to this workshop. I will try to be short due to the time. Next slide, please. I'm from the Italian Ministry of Health, and I'm part of the coordinating team of the European Partnership on Transforming Health and Care Systems. This partnership started in January 2023, is going to last 7 years, and it currently involves 63 partners, of which 23 member states and Horizon Europe associated countries and 9 regions. Next slide, please. The major aim of this partnership is to create and transform health and care system into people-centered systems through 3 main paths that are, next slide, please, filling the knowledge gap, implementation and transfer, and boosting health and care systems. The filling of the knowledge gap can be achieved according to our strategy through the definition of the problems and the target population, the stakeholders and the sector involved, and the measurement of the gap in the knowledge, and also, of course, by learning from the practices. Next slide, please. The implementation and transfer is the main part of our activity, because these partnerships aims to mainly implement and put into practice what the previous initiatives have taken to light in some way. And next slide, please. The boosting of the health and care system can be a consequence of these activities. Next slide, please. How can we reach these? Through an organization into 4 pillars. The pillar 0 is dedicated to the management of the partnerships, and then we have 3 pillars dedicated to the transformation of science and innovation into policy and into practice. The pillar 3, which is dedicated to the support of this transferability in the systems and in the in the ecosystems. And then we have the pillar 2, which is dedicated on the funding of the projects. Of course, in order to achieve these objectives, next slide, please. We need to put in place some synergies with other initiatives. As you can see from this table, one of the initiatives that we have considered for the implementation phase as strategical is the partnership on personalized medicine. This is because the personalized medicine impacts on health and care systems from the prevention to the cure phases, and research in personalized medicine undoubtedly helps the implementation of this innovation in health and care systems. Next slide, please. In going deeper in the structure and the activities of the work packages, in Pillar 3 particularly, we identified two ways to cooperate with the personalized medicine initiatives. In a particular way, work package 9, strengthening ecosystems, aims to build a connection among stakeholders such as companies, healthcare professionals, regional and national ecosystems, which can be reinforced by personalized medicine. And the work package 10, which aims to build a knowledge hub to support the transferability, will valorize the best practices which can be individuated also in the personalized medicine field, as well as training initiatives which can be inspired from best practices in personalized medicine. As Caterina told before, we have already launched our first joint transnational call, which is going to be finalized by beginning of 2024. Its title was Healthcare of the Future. It involves the 36 funders and more than 30 million as budget. The main aims of this call were two. The first one was to provide the necessary knowledge to build the health and care of the future, and this includes addressing several dimensions of health and care systems such as quality, safety, equity, efficiency, effectiveness, accessibility, sustainability, economy, ethics, and resilience in the organized health and care settings. By providing this knowledge, the call aims to support the development of new and innovative solutions that can address the current and future challenges facing health and care systems. The second aim was to support the implementation of innovative solutions on a larger scale, and this includes identifying and promoting the adoption of transferability of evidence-based and successful practices that have already been proven to be effective in some context, and that can be transferred into other ones. With research and innovation supporting the implementation of this existing solution, the call aims to accelerate the pace of change and make a positive impact on health and care systems in a more efficient way. We are going to launch a second, next slide, please. Sorry. Next slide again. Okay, thank you. We are going to launch another call. Sorry, Fabrizio, you have the mic on. And we are going to launch a second joint transnational call at the end of January 2024. I cannot anticipate the topic, but what we can say is that we are not going to overlap the work of the European Partnership of Personalized Medicine, but we are working really closely with them, because the topics among personalized medicine and transformation of health and care systems are really liaised in some way, and in a particular way at the beginning of our initiatives. I thank you for the time you dedicated me. In this slide, you can see our contacts. If you are interested in deepening the information about this partnership, you can contact us at coordination@thcspartnership.eu. Thank you, Caterina, and thank you, Eva.
Thank you, Chiara. And I think before leaving, of course, the floor to Eva in the next session, I would like also to emphasize that the synergy shown by this other partnership on personalized medicine approach, it's also important to underline that these partnerships are heavily international. So not only EU-based, but they are really including in this discussion on implementation of personalized medicine approach, other international actors outside the European Union. So this is, I think, an important asset also to underline to the audience of today. Thank you.
Thank you very much, Caterina. Thank you very much, Chiara, for this highly informative presentation. As I said before, we will have a question and answer session after this upcoming one to answer questions related to other presentations. So let me leave the floor to this new presentation, which is about the European Partnership for Personalized Medicine, which is called EP-PRMAT, and its complementarity to the IC-PRMAT, the initiative that has been running before and which is partly still running with the different sub-projects. And we will have an introduction, opportunities for future involvement in the international activities. And I'm very glad to have with us Dr. Gianni Derico, who is representing the Fondazione Toscana Life Sciences and EP-PRMAT responsible for international collaboration, also vice chair of the IC-PRMAT initiative. And Dr. Monica Frenzel, which is from ANR France and from the IC-PRMAT Secretariat. Welcome to you. Thank you very much for being with us. And the floor is yours, please.
Good morning, everyone. Can you confirm that you can hear me?
Very well, thank you.
Okay. Can I share my screen for the presentation?
Yes.
Or you will be scrolling?
We have one on the screen. Do you prefer to share yourself?
It's fine. So I mean, you can scroll for me. Thank you. So first of all, again, good morning, everyone, and thank you so much for the invitation. I am doing the talk, but the titles that were beside my name do not give justice to Monica, because she's one of the mastermind behind EP-PRMAT, IC-PRMAT, and she has been carrying out lots of work. So my name is Gianni Derico. I am the head of project management office in Toscana Life Sciences, as well as the vice chair of the International Consortium for Personalized Medicine. I will give you insight regarding the work that has been done towards the creation of the European Partnership on Personalized Medicine, the complementarity with IC-PRMAT, and a little bit of the structure of the EP-PRMAT and the internationalization work package, of which I am the coordinator. Next slide, please. Before I go ahead, I need to clarify a few things. I will go back on that also later. But the IC-PRMAT did not morph within the EP-PRMAT. The IC-PRMAT is a policy-making forum participated by national ministries, regional ministries, and policymakers. Is still it survives. It has independence and it has autonomy of the decision. What happen, as we will see in a few slides, is just that the EP-PRMAT is providing some logistic support to some of the activities of the IC-PRMAT, but the IC-PRMAT did not morph into the European Partnership for Personalized Medicine. European partnership that started, as all the partnership as we know, with the development and approval of a strategic research and innovation agenda, which required quite a few time to be developed and to get validated with all the stakeholders, and was officially published on the 28th of April this year. As you can see here, you can go on the website, or you can just use the QR code to download the SRIA. Regarding development, the development phase of the SRIA. Next slide, please. This is the time that it took to be developed. As you know, as you can see, the very first draft was outlined in February 2022. Then it started a long process for getting the expert and stakeholders feedback, and then there was also open an online consultation that to gather other inputs to fine-tune and finalize the agenda. A final draft was ready on November last year, and then it was also part of the IC-PRMAT workshop in January 2023, and finally, the final approval happened on April 2023. Next slide, please. The approach that the agenda has sought, and the approach that permeates the whole European Partnership for Personalized Medicine is the so-called system of health, which actually tackles all the main challenges along the whole value continue of personalized medicine, from basic research, translational research, into innovation. So let's say the clinical development, implementation into healthcare systems, and then back to the research and back to the innovation to tackle new needs and new opportunities that in the meantime raise. Next slide, please. Also, the strategic document that has been developed has also been it also contains 57 triplet of actions. Thank you, Monica, for the link. Contains 57 triplets of action. The triplets of action is a system motivated by also the European Commission work, where we define the main challenge, we define what's the objective of a potential solution to tackle the challenge, and we define also an expected outcome against which then we can measure and assess the performance of the European Partnership for Personalized Medicine and the overall strategy that we have been sought. Also, this process of the triplets of action is something that required lots of time and a lot of connection with the selected stakeholders to fine-tune and validate the whole process. Next slide, please. And as you can see, all these inputs that we have been received have also been organized in personalized medicine innovation enablers, inputs and outcomes, and also, let's say, policy implementation, again, as enablers, key inputs and outcomes. This is very important to plan the work and to have a grip on the massive activities that have to be carry out. So this definitely helped to, let's say, strategically organize the overall work that will come that has already started and will come in the next 7 to 10 years. Next slide, please. And so all this work that has been doing then was part of the proposal and then the project that has been approved by the European Commission, which is exactly the European Partnership for Personalized Medicine, or also EPI-PERMED. Next slide. This is the overall structure. We have kept the overall structure quite simple in terms of work packages. We have one work packages on coordination and management, which will provide the logistic support to the whole partnership, and the work package leader is DLR and the BMBF in Germany. Then we have the second work package, which is led by ANR and Monica. This is the main work package to ensure research funding to ensure support and funding to research projects. We can say that it's let's say the part that continues for the EPI-PERMED. The main scope, but not the only scope, is to publish and fund research through joint transnational call. As you might have seen, the pre-announcement for the first joint transnational call has been already approved and published online in the EPI-PERMED website and also IC-PERMED website. Then we have the work package 3, which is dedicated to innovation. So everything that comes from the research and needs to be sped up on the, let's call in the healthcare systems, is part of the work package 3 and is led by Flanders regions with the support of the IET Health. And then the fourth work package is dedicated to facilitate the implementation of personalized medicine research and innovation into clinical settings and into healthcare systems. And for that, we have dedicated let's say standalone work package, which is the work package 4. And the second transversal work package is the work package 5, of which I'm very honored to be the lead, which is dedicated to the international, translational, interregional, and all in all overarching collaboration. This is transversal to all the work packages because all the activities that will be born in the work package 5 will be used to support and maximize the outcomes of the work package 2, 3, and 4. Next slide, please. Regarding the consortium, we have 54 partners. We will dedicate a total of 300 approximately. These numbers, as you know, in all the other partnership can increase. 375 million euros as a total resource to the partnership, and 80% of this resource is being used to support third parties via transnational calls, both for research and innovation. The overall duration of the partnership is 10 years. For now, 7 years have been dedicated to the implementation of the activities, and the 3 years are dedicated to what we have called the phasing out stage, during which we will gather all the outcomes that we will have enabled in the meantime and organize all the activities like to guarantee sustainability and longer support to personalized medicine. Next slide, please. So as you can see, these are the next step. The pre-launch, the grant agreement signature is being finalized. Actually, the project has started on the 1st of November, but we are just now collecting the signature. The European Commission has opened the grant agreement for signature last week, so we are just now gathering all the signatures that are requested. The pre-launch of the EpiPyramid happened on the 4th of October. We will have a kickoff meeting of the work of the EpiPyramid, the official kickoff meeting in January 2024, but all the work packages have already kicked off with the dedicated meetings. As you know, the first joint transnational call has been published, and like on the bottom line, you can see all the next phase for the joint transnational call. Next slide, please. As this is important, as I said, it's important to highlight that IC-Pyramid is a continuation of still continuous. It remains an independent, autonomous body, which will provide its feedback to the EpiPyramid, to the update of the strategic research and innovation agenda, but it will not be part, it's not become EpiPyramid itself. All the national and regional authorities that are part of it express the desire to maintain the current governance in the IC-Pyramid. So this is a very good news for both the European Commission and also all the other stakeholders. Next slide, please. Sorry. This is the let's say, structure of the IC permit. We have over 50 European and international partners that represent public and private non-for-profit health research funding and policy organization. We have a high-level participation of ministries, funding ministries, both national and regional, funding agencies, and the European Commission itself. And of course, it is based on the international consortium model. Next slide, please. So for what concern the, let's say, translation of IC permit in parallel with the EPI permit, this happened through the work package 5 and the task work package task 5.1, where the European Partnership for Personalised Medicine guarantees the logistic support, let's say, to the IC permit. In particular, we support the adaptation and implementation of governance rules of procedures. We maintain the IC permit mail and the IC permit webpage. We support the process for the selection of the chairs and co-chairs, vice chairs of the IC permit. For the next phase, we support the organization of IC permit meetings, and we will have 4 major events organized within the, let's say, for the IC permit during the EPI permit duration. And of course, we also support the IC permit membership management, and we will continue updating all the stakeholders through the newsletters and state of art reports also within the EPI permit document. So all in all, the body, I mean, the consortium remains independent, remains a strategic body for the EPI permit, but the only thing that we do with the EPI permit to guarantee, let's say, the time-consuming and resource-consuming activities to for the let's say the organization and implementation of its mission. And next slide. With this, I think I am done. These are the list of contacts, both for IC permit and EPI permit. And if you have any questions, I'm here to answer.
Thank you very much, Jenny. Very, very insightful. A lot of information. And also thank you to Monica, who has put a number of links in the chat for those who wish to receive further information. Please check these different links. And now I'm inviting you all to the question answers session to the different speakers we have had until now. So please feel free to put any questions you might have in the chat, or you can also switch on your microphone. And thanks a lot to all the speakers for being available here. Okay, someone is writing that she cannot see the links as she's joined late. Yes, these are actually the links which are also on the slide we just saw regarding the different initiatives, but we will make sure to gather them all when we send you the follow-up email, and you will have them in the email then. Yes, thank you for the question. Are there any other questions or remarks to the speakers? Okay, so for the moment, I don't see any. If anything is coming to your mind, don't hesitate to also ask them a bit later when we have another question and answer. So then I suggest we move forward to the next session, which is our session 2 on personalized medicine collaboration between Europe and China, on opportunities and challenges. And I'm very glad that we're cooperating here with the IC2 Permit project, which is organizing this session. And we will have several presentations from this project, starting, however, through a video, which will give you a quick glimpse at what IC2 Permit is standing for and what has been activity that's undertaken in this initiative. So please, we will launch the video and hope you can all see and hear it correctly.
data, lifestyle, health.
I'm sorry, I started from the start because I was muted, yes.
Personalized medicine has already advanced the patient's quality of life through tailored treatment by maximizing the use of available data, lifestyle, health, environmental, genetic, and combining it with digital innovation. Personalized medicine will impact the health of the population. Personalized medicine has great potential, but faces challenges such as inadequate evidence, incompatibility of data systems, and misalignment with population needs. To bridge these gaps, international collaboration is essential. China's large population could contribute to a high incidence of rare diseases. Collaboration between Europe and China, with its long experience in traditional medicine, is further strengthened by their shared interest in personalized medicine. The IC2 PERMED project, aimed at fostering relationships between Europe and China in personalized medicine under the umbrella of the International Consortium for Personalized Medicine, IC2 PERMED, was funded by the European Union in 2020, involved 10 partners across Europe and China, and was coordinated by Università Cattolica del Sacro Cuore in Italy. A complementary research project has been funded by the Chinese Ministry of Science and Technology to testify the strong commitment in strengthening the relationship between China and Europe in the field of personalized medicine. IC2 PERMED promoted innovative and inclusive healthcare solutions in personalized medicine between Europe and China. One of the key results in the IC2 PERMED roadmap, co-created by scientists, industrials, policymakers and funding agencies from Europe and China. The roadmap outlines strategies for enhancing European and Chinese collaboration in personalized medicine, focusing on 4 main areas: healthcare system sustainability, education and empowerment, big data and IT solutions, and research and market innovation. IC2 PERMED outlined the need for a stronger collaborative biobanking framework developed through roundtables with 150 participants from 25 countries. A memorandum of understanding signed in Beijing solidifies a sustainable collaboration framework between European and Chinese organizations through IC2 PERMED. Check, share, and use the IC2 PERMED results. In the field of personalized medicine, substantial progress has been made, yet it is far from being complete. Collective expertise is crucial for advancing healthcare and overcoming global health challenges. The IC2 PERMED project united 86 health specialists from Europe and China. It's time to expand. Join the international community. Contribute to the activities of recently launched European Partnership for Personalized Medicine. Check out the opportunities for research provided by the Partnership on Transforming Health and Care Systems. Join the International Health Innovation Forum of Enrich Global, with over 600 health specialists from across the globe. Join us on this transformative journey. Let's reshape the future of healthcare innovation together.
Great, thank you very much for the video. I think it stands quite for itself, doesn't need much more introduction, but you have seen that there's also the link to the website, of course, if you wish to have further information on the IC2 PERMED initiative. But first of all, we're now welcoming Professor Stefania Boccia, who is the coordinator of this initiative from the European side, who is from Università Cattolica del Sacro Cuore in Italy. And Stefania is presenting us on how personalized medicine research and policy collaborations between the EU and China could be fostered. And she's specifically presenting the IC2 PERMED roadmap that has been developed. Stefania, the floor is yours. Thank you for being with us.
Thank you very much, Eva, for introducing me, and thank you for organizing this excellent webinar with Enrich Global. So please go to the next slide. We are basically approaching the end of this project that lasted 4 years, that is a coordinating and support action funded by the European Commission and involving 10 partners. So we were not alone along this journey, because we were working also very closely with another sister project, which is the Sino-UPermed, again, funded within the umbrella of IC-PerMed from the European Commission. The overall goal of IC2PerMed was finding key solution and establishing a roadmap, a path, in order to converge European and Chinese stakeholders towards a common approach in personalized medicine. Next slide, please. The partners are mostly also, I hope that almost everybody is present online. I see almost everybody online. And we were working for 4 years very hard together with Chinese counterparts that were good enough to be also funded from the MOST, which is the funding support from the Ministry of University and also of Technology in China. So from the European counterpart, you see the partners in this slide. Unfortunately, we don't have time enough to go in details, but you will see additional insight in the next slides. Please. The IC-PerMed is an international consortium of personalized medicine. You learned from the previous presentation of Gianni and also from Caterina what was this about, because now IC-PerMed basically evolved in the AP-PerMed. So I don't want to spend too much about this, but the IC-PerMed vision of for 2030 is the one that was used from our consortium in order to inspire our activities, because at the time it was published, the AP-PerMed was not existing yet. And this was a time also where IC2PerMed initiated its initiative. Next slide, please. So, okay, now we basically know about the AP-PerMed initiative, and we will learn how to continue interacting in the context of international activities of AP-PerMed. Next slide. Our approach, again, as I said, was inspired to the action plan of IC-PerMed 2030, the one that was living at the time we submitted our application. And we had three main work packages, scientific work packages, 1, 2, 3, that were dealing with 4 major approaches. The first one was about mapping. So we thought that a good understanding of personalized medicine approach and policies in China and in Europe was the first thing to do. Then we moved to expertising, that basically consisted in engaging a community of stakeholders in Europe and China involved in personalized medicine research and policy making. Then exemplifying, so setting a concrete practice of successful collaboration, again on specific themes like biobanking. And in fact, you will see that we also organized a number of webinars on the topic, and we delivered a specific deliverable about biobanking. And lastly, creating a strong collaboration with 2 delegation visits that happened in Italy and in China. Next slide, please. So in order to elaborate the roadmap of IC2PerMed that now is available on our website, so everybody can go in the IC2PerMed website and can download the roadmap. It took a while, okay? So we didn't elaborate this roadmap in few months. It took almost 2 years, as I said, because we proceeded using a stepwise approach, starting with the activities of 3 different working groups, fed by experts that we engaged over the time. So next slide will show how we started our activity. So first of all, we did a mapping exercise, very extensive. All the deliverables have been approved from the European Commission. So if you want to check the details about all the mapping exercise done on personalized medicine in China and in Europe on different topics, you can read it in details, because now we don't have time to go across these deliverables. Next slide, please. As I said before, along with mapping exercises, we decided to engage a number of experts, okay? Because we wanted to have a flavor from Chinese and European experts on personalized medicine on what was happening in the countries on the development of research, innovation, and policy making in personalized medicine. And therefore, we published a survey in order to engage more stakeholders as we could. And also in the next slide, we also submitted individual questions to the experts that were engaged in order to collect some basic information about their expectations, okay? So the next slide shows the results. You can see that this has been published in BMC Health Service Research this year. You can see that the most important, let's say, impacting factors in personalized medicine, according to European and Chinese experts, were those related to research funding and also to big data and ICT solutions. So we had quite an alignment in the vision of European and Chinese experts about the challenges of personalized medicine to tackle in the future. Next slide, please. Also concerning the barriers, I have to say that also the barriers were quite similar from European and Chinese experts, although some difference emerged, as you can see from this chart. Next slide. So this was the basic part, okay, of our activity of the first year. And then, as I said, we built on the mapping and the expert survey in order to create 3 working groups working on 3 specific pillars of the action plan of ICP per Med to start a discussion on different, but still, as I said, relevant topic. In order to do this, we organized 9 interactive expert workshops, and after this workshop had been organized on these topics, we sent out 12 Delphi surveys, okay, in order to gather priorities to build our roadmap. We identified, unfortunately, a large number of priorities, so 65 priorities, both from European and Chinese part. Because there were definitely a lot of priorities, probably too much in order to build up a more concrete roadmap, we moved from priorities to actions, okay? So in the next slide, you see what happened in Rome in a validation workshop where Chinese experts, European experts convened in person and online in order to summarize these 65 priorities in concrete 7 topics of the roadmap. Okay, so you will see now the roadmap as it is. Working group 1, that was about shaping sustainable healthcare in personalized medicine area, identified these 3 priorities and 3 main actions: improving empowered and responsible citizen, promoting trained and up-to-date healthcare workforce, and fostering healthcare system sustainability. If you want to read all the specific actions details, again, please download the roadmap and you will find everything you need to understand more the details, because we don't have time, sorry, to do it now. Next slide, you will see the activities of working group 2 that was about innovation and market, with all the priorities identified concerning big data and bringing innovation to the market, and the 2 main actions that we thought were relevant: bringing innovation, adopting the data and set solution with possible, as I said, activities embedded in each of the 2 actions. Next slide. The 3rd working group was about research and clinical studies in personalized medicine. And again, the 2 main actions were about fostering research funding and translating basic clinical research and beyond. It might appeal to some probably participants that this topic had been repeated and discussed in many different settings, but believe us, the fact that we were aligned with our Chinese counterpart was actually not given for granted, while instead it was, I think, in my perspective, one of the main output of our project, the fact that we aligned our vision on these topics. Next slide, please. We also try to detail which can be the area of future collaboration and cooperation and the challenges, because of course we have communication barriers, ethnic disparities, different public awareness and perception of personalized medicine in Europe and China, and also the big deal about access of the data that has different legislation and different approach in Europe and China. Next slide, please. Just these final slides are just for you to know what we did in the past years concerning roundtable and concerning next slide, also delegation visits. Just for you to know that on the website you find more, and every time you want to ask whatever information beyond GAC, you can contact me, because the project is not finishing really now. It is finished because the period is finished of 4 years, but we aim to continue the collaboration with our Chinese counterpart also thanks to the fact that they still have to work because of this mosting funding that will last for another year, I guess. And so, yeah, so that's it. All the slides reporting pictures and all the success of this project. So for me, it's important to thank now all the partners again. And if you want to also read our scientific manuscripts, you can again go on the website and download the papers. Thank you very much for the attention.
Thank you very much, Stefania. A lot of information because a lot of things have been done. So great to see all these results. And I already invite the participants to put any questions you might have to Stefania in the chat. We will answer them at the end of the whole session. So then I would like to invite Dr. Wenye Wang, who is director from the Biologic Therapy Research Center of Beijing, and Tsinghua Shangjong Hospital Project Director, and representing the IC2PROMAT initiative from China. And she will give us an overview of the current precision medicine landscape in China. Thank you very much for being with us, and the floor is yours.
Thank you. Thank you for introducing myself. My name is Wenye Wang from Tsinghua University. Yeah, today I want to give a short interview of the overview of the current precision medicine landscape in China. Next slide. Yeah. So I will, in the following 10 minutes, I will have a quick introduction of the China policy system and have some current state of the precision medicine developed in China, and also our ongoing project funded by the most and the Ministry of Health. So next. So this slide shows the organization of the China State Council institution. We have the 26th ministry and another 9 direct report institutions under the State Council. Among this organization, there are 5 very important ministries related with the precision medicine. For example, one is the National Health Commission, another is National Development and Reform Commission, and third is Science and Technology, and other is China National Medical Product Administration and the State Marketing Regulatory Administration. Another one, the last one, is the National Medical Security Administration. That's the very key information, governance or focus on the precision medicine policy. Next slide. In this slide, it shows the very detailed information of this role and responsibility for these different governance and administration. We know the scientific research system of precision medicine covers the entire innovation chain from knowledge discovery through the basic research to clinical application, and required coordination of all the relevant entities and synergetic management approach. So the most important policy department from the basic research, clinical research, and marketing approval and post supervision, and for the drug and device, and also the medical treatment insurance and the price negotiation. And that is very important for us. So before we go to the detail, we have the general picture of the identified stakeholder of the precision medicine system in China. Next, please. There are a lot of law and regulation. We just listed some important law and regulation focused on the precision medicine clinical application of the precision medicine. We don't show the detail. Next. The definition, we know the Europe definition of the precision medicine. For China, there no official launch the definition of the precision medicine, but we have the general identification launched in our precision medicine key precision medicine project under the 13th 5 years plan. So and in the special precision medicine plan, they are further enriched and improved the implementation paths of the precision medicine. So they are all help us to understand more. So in China, their identification from the expert is they are from the high level expert group. I think it's the same understanding and content with the global identification. Next. We know there's a China Personal Medicine jury. Since 11th 5-year plan research project related to precision medicine have been carried out, and the National High Tech R&D program of China. So this project covers the genomics of disease and the disease classification on the molecular level. So they also support. There are also a national key science and technology infrastructure for translation medical. This project is support in the 12 years 5 years plan. So in the 35 years plan, the Ministry of Science and Technology strategically designed and prospectively launched our key precision medicine research funding and the key scientific and technology program. The project formulated plan in the 2015 and was launched in the March 2016. So providing a policy in this project is providing policy and funding support for precision medicine developed in China. The specific key project have 5 important tasks, which will indicate in the next slide. Besides that, there are another important, last slide. Yeah, there are another important funding program we need to indicate. In 2018, China most have launched their medium and long-term plan for cure some special disease prevention and control, and also the National Development Reform Commission also launched a program in 2017 that is the development of a biological industry. So this is worthy to emphasize that the key precision medicine project, which launched in 2016, will not continue funded by the most. Some related research area will be covered by the new major R&D program in our 50th 5 years plan. So, for example, there are some new funding project titled with biology and information governance and prevention and treatment of common disease and the frontier by tech. This is some new science and technology project funding in the 55 years period. Next slide. So the 5 major area of China precision medicine research project. First, we have the 5 tasks indicate in our key precision medicine project. First is research and the development on the live omic technology. Another is research in the large-scale population cohort. The third one is a big data platform that to achieve resource integration and storage and utilize and sharing data. The third one is the research on the disease prevention and treatment plan. In this task is to develop protocol and strategy for the precision medicine disease prevention, diagnosis and treatment. And the last one is the research on the clinical application, demonstration and promotion system. That's the 5 key tasks in our key precision medicine project. We almost, I think almost 102 projects has been funded since the 2016 and to the 2018. They are totally, I think, funded by 1.3 billion from our government. I think we are a lot of achievement in this area. First, we have established the national cohort framework of the precision medicine. There are a lot of there are 1.5 million people in special disease cohort and almost 40,000 people rare disease cohort. And also establish a big data platform to promoting a standardized of data and share application. And in this area, in this period, we also have fundamentally established our precision medicine knowledge and our share our bank. Almost 9,000 researchers and covered in the 500 institutions in have contribute in our key precision medicine project. Next. In our 35th years plan, the China government also funded a 5 translational medicine research facility that located in Beijing, Shanghai, and Chengdu and Xi'an province. That is a very important science and technology infrastructure for our precision medicine. Next. Yeah. Also, we have 50 national clinical research center have been established during the from the 11th 5 years plan to the 30th 11th plan. At this period, we have established the National Clinical Research Center focused on the 20 disease area and located in different way. That generic testing technology application demonstration center funded by the National Development and Reform Commission. There's almost 30 demonstration center for application for generics testing technology in our almost 23 province and city that focus on the generic screen and for genetic disease and birth defense. Next. Next slide show our 15 national clinical center that in funding during our 11th 5 years plan to the 30th 5 years plan. This covered 20 disease areas located in the 12 prevention. That collaboration network for the disease research has been established and issued almost 200 guidance and technology specification for different kind of disease. That guidance may focus on different areas. Some is a clinical research specification, another some technology specification. They are focused on the clinical trial design and data management and ethics review, also contribute to the international guidance. That's the great effort to our National Clinical Center. The result of this effort has to help to improve the scientific research level and the clinical practice capability of the National Clinical Medical Research Center to promote our medical science innovation. Yeah, next. Also, MOST launched some national health information technology strategy plan in 2019. There, in the carry out of the IT plan, almost 20 national scientific big data center have been launched, and 2 of them is focused on the public health. One is a national genomic data center, another is a population health data center. Also, we call them population health data. That this data in integration involved biomedical science, basic medicine, clinical medicine, and pharmacy, and public health, and other scientific data also integrate in that different database. Next. We also have another big data research center located in China and Beijing. If you can interested, you can go to the website to find more information. Next, please. For the precision medicine on rare disease, China have the 11th and 5th 5-year plan to focus on the rare disease. At the first stage, they established the rare disease and clinical hard work platform. In the 35 years plan, most have launched a clinical pre-research on rare disease project. In this project, their clinical case reporting standard has been established, therefore covered by 105 rare disease. And they also have the collect and the management clinical information of a large rare disease patient. There also involve more than 20 rare disease. In the 5-year plan, some high-level experts have the special research on the precision medicine. They give the high-level suggestion to develop the precision medicine on rare disease. Next. As we noticed that the key project of the precision medicine will not continue support in the 40th 5-year plan. So some related research has been covered by another new program. So at the same time, most of health and most of science and technology also co-founder some special plan on science and technology and innovation of healthcare. In this project, they will continue improve construction of the platform. They will more focus on the stress application of the basic research and accelerate the research and development of medical and health product, and also develop new practice health technology and new model. In this project, they focus on the improved big data center for major disease and biobank, also establish the mechanism for collaboration and sharing international scientific and technology cooperation. Is a very key information emphasis point in this project. So it's a continue where there will continue issue the application guidance. We will share the new information if we got the update application guidance. Next. What and how this method develop in China towards the 2035? For this question, the Chinese Academy of Science and National Science Foundation of China, which support basic research, joint conduct a research project. In this research project, the project named the Strategic Research on the Development and the Disciplines of Frontier Field in China. In this project, the team invited scientists and technology from the different fields to analyze the key technology and the priority of precision medicine developed in China. They all finally divide in the 20 topics. The study proposed and developed plan and the recommendation for precision medicine in China towards the 2035. So that indicates that high quality big cohort, big data, and precision prevention, diagnosis, and treatment protocol is very important for development, precision medicine development in China. So they also give some 3 steps to continue improve our precision medicine system in the future. Next. That's the priority area for development precision medicine in China. There are 6 experts. First is developing the like common technology and equipment, and second is the construction of the standard and the related and the high precision natural big cohort. The third one, it suggests to build standardized and share the national big data center for precision medicine. Also focus on the rapid industrialized of advanced therapy, immunotherapy, and gene therapy. In that recommendation, they also put the some priority area to demonstrate of application of disease and can be treatment with the precision medicine in the future. That's the key priority area suggested by our high-level precision medicine group expertise. Next. To promote precision medicine development in China, it is very important to establish a long-term continued funded mechanisms. So in this research project, they also to give some high-level suggestion. So in our discussion, in our ICPOMED, we also have some high-level suggestion we'll submit to our most to consideration. So some of this key message from our draft paper. Next. So we have the ICPOMED official approved by our China Most, and the project time is 3 years. And this project will finish at 24 September. So this ICPOMED in China is led by Tsinghua University and co-led by the Cancer Hospital and BGI Life Science Research Institution. Next, that's our counterpart from the China team. We have a brilliant work together with our European counterpart. Next, we also have the WeChat and some website to visit. So next time, welcome to all the experts to go China to have the one face-to-face communication in the future. Thank you. That's my final slide.
Thank you very much, Dr. Wang. Very informative. I see that you've been doing a lot of things, and I'm sure there's more to come because you still have 1 more year running. So thanks a lot for this presentation. We will have the question answers at the end of the session, as always. So I'm passing the floor now to Dr. Maike Tauchert, who is joining us from Austria, representing the Biobanking and Biomolecular Resources Research Infrastructure, European Research Infrastructure Consortium. And she will present us a presentation about paving the way for EU-China collaboration in biobanking. Dr. Tauchert, the floor is yours, please.
Thanks a lot, Eva, for the introduction and also for the invitation to today's webinar. So I'm happy to give you some insights on what we were working on within the IC2PERMED project in the recent years. So I'm Maike Tauchert. I'm working for Bibi Marai Eric. We are a European research infrastructure for biobanking and biomolecular resources. And what is very critical to progress in the health sector, and also more specifically in the area of personalized medicine, is that institutions and scientists need to join forces to tackle pressing issues together. So collaboration is very important and needs to be successfully carried out. So specifically for biobanking, it's often needed that you have a large number of biospecimens available, also with the associated data and clinical data. But it's also important to have a certain heterogeneity of these. So, for example, with regards to ethnic groups, disease characteristics, and so on. So here it is often the case that researchers are largely dependent on collaborations to gather enough of that source material, which can be biospecimens and or data, so that they can perform analysis that really have sufficient statistical power and also significance in the end. So what we saw is that there are like two main approaches for this collaboration, which is key in the field of personalized medicine. There is on the one hand this top-down approach, so projects are initiated by funding agencies, by initiatives in the EU and China. But on the other hand, there's also this bottom-up approach. So you have individuals, individual groups, or institutions that are joining forces, for example, by setting up joint research structures, exchange programs, educational and or PhD programs. Next slide. So as we think that this collaboration aspect is very important, not only in personalized medicine, but also specifically in biobanking, it was first intended to have a face-to-face workshop in this IC2PERMET project where experts can discuss on this topic. Unfortunately, due to the COVID-19 pandemic, this was not possible. So we had to find another methodology to tackle this issue, and we came up with 4 virtual roundtables that were organized, led by Bibi Mirai, but of course heavily supported by our Chinese partners and European project partners as well. So the main focus topic of this was biobanking, and then we had also related topics and aspects with data quality and ethical, legal, and social issues. And these virtual roundtables were performed at the end of 2021 and the beginning of 2022. And we were very interested discussing with European and Chinese experts on the main topic and these interrelated aspects, building also on the Work Package 2 achievements of the IC2PERMET project, as Stefania already introduced, the different working groups, and of course also the in that time point evolving roadmap of the project. So to give you a short idea, these virtual roundtables consisted of short presentations of the European and Chinese experts that were invited. And then we had very extensive question and answer sections and room for discussions planned. And in total, this was very well received. So we had almost 150 participants from 25 different countries that participated in these 4 virtual roundtables. Next slide, please. So to give you a short impression on the output of these virtual roundtables, so we had these short presentations followed up by fruitful discussions. The main idea was to have a better understanding what is the current situation in the field of biobanking. And we came up with a list of several facilitating aspects. I only put in here the small screenshot. You will not be able to read that in detail, but this is publicly available. So a lot of facilitating aspects were identified, but we also had some strongly inhibiting aspects identified for this EU-China collaboration. I would like to only highlight a few. So for the facilitating aspects, we identified that the biobanking setting is very similar in the EU and China, with mainly healthcare integrated biobanks that support a lot of contemporary research like omics technologies and personalized medicine. Then we were able to showcase examples of this already introduced top-down approach for collaboration based on money from funding agencies, but also examples for this bottom-up approach where individuals and individual institutions join forces to collaborate. And as I think we also saw very nicely in Venya's presentation, that the value and the potential of data in general, but also big data specifically, is recognized in the EU and China, and appropriate infrastructures are being piloted or established at the moment. And another very facilitating aspect that we identified was a very successful international collaboration in standardization. So quality is of high interest for the EU and China, also specifically for biobanking to adhere to existing standards and to exchange best practices. But of course, we also saw that regarding inhibiting aspects, there are still a lot of legal requirements that are not yet well sorted out, how they need to be interpreted to allow for this cross-border biospecimen and or data exchange. So if you're interested in that, we summarized all of these outputs and discussed them in a public deliverable. And we also put this together in a more compact format that you can see in parts here on the slide in the format of a policy brief, which is available on the IC2Permet website already. Next slide. So what I would like to inform you about some main recommendations that we then generated based on these facilitating and inhibiting aspects. So really to have these joint policies, this common understanding for cross-border biospecimen and or data exchange. We think that promoting and further developing this data center infrastructure space is needed, specifically also for big data, so that we can further support the use of health data in a global context. And as we already saw in the first session, further funding is needed for future collaborative projects between the EU and China. So big initiatives just recently started, but of course, there's always the need for funding also for smaller projects, particularly for personalized medicine. We think that it's really valuable to promote the application of the fair health principles regarding findability, accessibility, interoperability, and reusability of data, which would ease the collaboration significantly. And we think that it would be great to have incentives that, especially in biobanking, international standards are implemented in European and Chinese biobanks, because then we can really promote this international harmonization and collaboration. And we also think that there's further support needed for institutions, but could be also individuals that would like to prepare and offer cross-border trainings, that want to foster community exchange and promote the literacy regarding health and digital aspects in the public. Next slide. So what was a major milestone that was recently reached in the IC2Permet project, and Stefania already briefly mentioned this, was the signing of a memorandum of understanding during the delegation visit to China in October 2023. So the output of our virtual roundtables was also included in setting up this memorandum of understanding to define some common areas of interest. So here the main driver for this was also our project partner Fondazione Teleton that created the first draft, which was then complemented by all project partners. And we were very happy to see that this was then signed by all project partners and is now really a key turning point, I would say, to further go on with the collaboration. So for BBMRI, we would like to continuously exchange with the Chinese project partners, but of course also with other Chinese interested parties that are working in the area of biobanking, and would like to further explore the collaboration opportunities in these areas of common interest, biobanking, data standardization, in the interest of personalized medicine. So I think this is now a great starting point, and seeing that the Chinese project is still running for almost 10 months in 2024, there will be plenty of room to further discuss this. So I think this was the last slide. I thank you a lot for your attention, and I'm happy to take questions later in the question and answer section.
Thank you very much for this presentation. And maybe I guess it refers to what you had actually on your second last slide. We have in the chat a person who indicates that they would be interested in signing the MOU. I guess it refers to this MOU, so you might want to check in the chat, please. So thanks a lot again, and I would like to invite Dr. Xin, who is the Deputy Director from BGI Research in China, and he's presenting us practical experience and insights in supporting precision medicine at the Shenzhen China National Gene Bank. Dr. Xin, would you please set up your slides?
Sure. Thanks, Eva, for the introduction. And I also want thanks a lot for the IC to Permit Committee give the opportunity to me to share some of our experience we learned by operating the China National Gene Bank and the bio database. My name is Xin from BGI Research. We are located in Shenzhen, China. If you do not know Shenzhen, that's a very young and modern city, very close to Hong Kong. So it's very easy to connect to us. So as a background, we are all talking today about the importance of the precision medicine, and the bio data and the biosample storage is one of the most important resources to supporting such kind of efforts. So as we all aware, as the UK Biobank, Danish, and also the Global Seeds Biobank in Sweden, and there's also lots of the national level biotech and bioinformatics center in Europe, US, and Japan. It's kind of a 10 years efforts here in China. So the establishment of China National Gene Bank actually is starting since the 2011. At that year, the China National Gene Bank was approved by China government, and it was operated independently by BGI Research. That's the institute I'm working on. And it was a very good model, I think, for supporting and sharing all of the resource, all of the infrastructures, and with a lot of input, not only from government, but also for corporations and hospitals. So here is a roadmap, how we establish the entire things. It was approved in the end of the 2011, and we have the board established 4 years later. And in 2016, actually, we are very happy to have the establishment and the open ceremony of the China National Gene Bank. And later on, in 2018, actually, we are established another very important infrastructure, that's China National Gene Bank database. We call CNGBDB. It was mainly an informatics infrastructure to supporting the bioinformatics and biodata. Also, we were getting a lot of support from the China Great Bay Area policy, and we got a lot of support from all of our Chinese collaborators and worldwide collaborators. So last year, we are having our second board meeting, and we have make the proposal for establishment of the second phase of the China National Gene Bank. As you can see, actually here is a real picture. It's not a cartoon, it's a real picture. It's a very beautiful location in eastern part of the Shenzhen, just beside the sea, the ocean part. And we are having a lot of the equipments for biosample storage, but also we are having a lot of very cute animals. As you can see, we have alpaca, and we also have the flamingos walking around in the campus. So it's a institute not only for research, but also for education. So a lot of the students from primary school and middle school, they visit us many times per year, and to learn the technology of biodiversity and precision medicine. So the mission and the aim and the purpose is operate the infrastructure and make it to be owned by all and shared by all, complete by all, for people's realness and also for the biodiversity. As I just mentioned, we are having two major infrastructures, not like other bio bank or the gene bank. They may only have biosample storage, the bioraspberries, or they only have the bioinformatics center. We have both established together. So as you can see, we have world-leading integrated biosample repositories, and it was incorporated not only for animal and plant samples, also have a microbial sample and the samples from human, from health and the disease. And then we also have a platform to supporting the digitalizing of the biosample. So the sample, the storage and the sharing has a lot of limitations. If we need to have the shipment and very low temperature to making sure they are at the good states. But if we are able to digitalizing them to be data, and then we analyze and interpret the data, the result and the knowledge we have is much easier to be shared. So we are utilizing our own developed technology and cooperate together with the bio raspberries to digitalizing the different category of the samples to make the one of the largest bio database in Asia Pacific region. And then a lot of the discoveries, we publish them, we make them to be an open access database through the China National Gene Bank database, and also give the open access for all of our platform and the infrastructures to not only the research collaborators in China, but also for our worldwide collaborations. So here, as you see, we have multiple level automatic low-cost and high-throughput bio repositories, and the capacity of the storage is about tens of millions. And also we separated them into different grade. As you can see, we have the full grade for the temporal storage for first samples. We also have -20 for seeds for whole blood. We have -80 for DNA, RNA plasma, buffer code, saliva, and other biosamples. We also have the -196, that is for tissue and for live cells. So all of the facilities, we are having the capacity to share with all of our collaborators. And we have a very good management system that making us can provide 7 days, 24 hours services. And also we were able to digitalize all the status of the samples and tracking them. Then it would be kind of easy to find the right sample from the tens of millions storage the sample here. We already utilizing our infrastructure to support the cohort studies for large groups, and also for precision medicine, also for the diversity and for breedings. Here is the platform for the digitalizing. Actually, what we are able to do now, having the ability for whole genome sequencing, transcriptome, metagenomics, for single cell omics, epigenomics. Also, we are developing new technology. For example, last year, we launched one of the new technology we call the spatial omics, STOC. The spatial omics is kind of a technology. We are having the single cell level resolution, but we also able to gain the location information on the space of the real tissue sample. Then it will give us a lot of the information about what's the biology information behind. And we have the full free access and support for all of our collaborators. As you can see, we are keeping developing the technology and making them available through the China National Gene Bank. Here is 2 lines. One is for the sequencing cost per gigabase per yuan. And also another line in blue actually indicating the new establishment of our machines for sequencing. And you can see how the generation of the data throughput per year was rise dramatically. And we are having all of these resources ready to supporting all of the potential collaborators. Also for the bioinformatics data center, you can see the pictures below. Actually, they were just operating for 4 year, 24 hours every week. And the stable and the security is so important for bio data. So we're making sure we are having a very strong support team to having the ISO certification and a lot of the regulations to making sure we are holding the data in a safe place, and at the same time we could utilizing the infrastructure to support the research and the clinical collaboration and utilizations. So as you can see, the China National Gene Bank database is a very unique and useful platform built for the biological big data sharing and applications. Here is the main page of the CNGBDB. We have lots of the database already established there, and you can see the data already be stored in the CNGBDB is already close to 10 PB, and we were also recognized by close to 20 international journals and alliance and publishing groups, including the Elsewhere, Nature, Science, Cambridge, Oxford, and many major publishers. They accept and recognize CNDBGB as a database, could be the utilizing and as a support platform to host the data used for scientific research publications. As we all know, the data sharing for scientific research and precision medicine is so important. So we are utilizing the ability we established here to support and accelerate the publications. And the papers related data could be shared and stored on the CNDBGB platform with all of the certificate of not only for FAIR sharing, also the RE3 data and Open DORA, such kind of the organizations. And a lot of database. Here we just showing some featured ones, including the database from the plants and animals, microbiomes, virus and disease and health. So all of this database we're making freely available to not only Chinese scientists, but also for all of our global collaborators. So all of the researchers, they can easily visit it and log in and visit and analyze the data they have interest in the database. So there's a lot of collaborations, and we hopefully we could have more from the Europe and from other region of the world. All right, I think that's a very brief introduction about China National Gene Bank, and we really want to thank again for the opportunity for the communication and this opportunity to learning from all of our experts in this consortium. Thank you so much.
Thank you very much, Dr. Jin. A very nice presentation about this impressive infrastructure in a beautiful environment. So thank you very much for having been with us. I invite all participants again to put any questions you might have in the chat. And we're now coming to the question and answers to all the speakers of this session 2, which are related to the cooperation between Europe and China. So if you have any questions, please feel free to put them in the chat, or also you can speak up putting on your microphone. I've seen that there have been a couple of questions or comments in the chat on how to join the IC2 PREMED initiative. I think this has partly been answered already in the chat, but if anyone would like to comment on that, please feel free. Also a question about signing the MOU. If anyone from the IC2 PREMED consortium would like to comment on that. Okay, the answers are provided in the chat, I see. And all right, if there are no further questions or remarks, I would suggest that we move on to the next session. Okay, thanks a lot again to all the speakers from the ICT Premier Initiative and the invited speakers that have joined us. So let's go on with session 3, which is towards a personalized prevention roadmap in Europe, a co-creation process based on the PROPHET project, an EU-funded initiative also, which is currently still ongoing. And I'm very happy to have again Professor Stefania Boccia from UCLC, who is coordinating this initiative, and who will give us an introduction to the PROPHET project. Stefania, the floor is yours.
Again, thank you, Eva. So I will try to resume in 15 minutes what we aim to do with the PROPHET project, which is still a CSA funded from the European Commission in the framework of the Horizon Europe program. So more specifically, I will talk about how we aim to co-create a roadmap for informed policymaking in personalized prevention. Next slide, please. So PROPHET project has been funded already 1 year ago. So we started our activity with a kickoff meeting in Rome, and it is embedded in the umbrella project again of ICPermed. It will last for years overall. Next slide, please. The partners are listed in this slide, but there are a lot of information if you go on our website. And I think there is something missing in this slide, probably because of the copy, but you can read with different colors the roles of the partners according to whether they are coordinating or work packages in green, coordinating of tasks in yellow, or beneficiaries in blue. But still, this is the complete list of partners that participate in this project of personalized prevention roadmap. Next slide, please. So the roadmap has been reported as one of the important key output of the implementation roadmap of the European Beating Cancer Plan. The European Beating Cancer Plan has been published in 2021 and reports a number of actions that should be implemented thanks to the funding support of the European Commission in different lines of support in order to achieve a number of health outcomes of the European population that is largely affected from the burden of cancer. And specifically concerning personalized prevention, the expectation of the European Beating Cancer Plan is that a roadmap to personalized prevention is delivered from our projects by the end of 2024. So we have 1 year left ahead of us in order to deliver this important output. Next slide, please. Just as a reminder, the European Beating Cancer Plan, that will be revised anyway at the end of the next year, is structured among around four key action areas. So there is a pillar on prevention, a pillar on diagnosis and treatment, and another pillar on supporting the quality of life, and a cross-cutting issue about understanding, but also ensuring equitable access to cancer prevention and care. And the ambition of the board of the Mission Cancer that has been established along with the European Beating Cancer Plan publication is that by 2030, more than 3 million of lives are saved. Of course, all these important achievements will be reached thanks to the 4 billion euro investment of the European Commission in order to implement the cancer mission activities. Next slide, please. In the specific objective 2, the one I was mentioning earlier, prevention represents an important pillar. And when it comes to prevention, this a priori is expected to be the most cost-efficient long-term cancer control strategy, also in terms of economic benefit. And this is where our personalized prevention project fit in. Next slide, please. We have to say that we, as a coordinator of this PROPHET project, we are not naive in the topic of personalized prevention, because thanks to another previous funding support of the European Commission, the project PRECEDI, which is personalized prevention, again, of chronic disease, that was, however, a Marie Sklodowska Action project, delivered recommendations in order to foster the integration of personalized medicine approach in the field of prevention of chronic disease. This you can still read on our website of PRECEDI project and a publication that is reported in this chart. The project finished, as I said, but we took advantage of the discussion done in the context of this project to build up our profit objectives and community of stakeholders. Next slide, please. At the beginning of the project, when we met in Rome for the kickoff meeting, we had to convene on a definition of personalized prevention. As you can see here, we didn't have a definition at the time, so we delivered this definition that is reported also on our website in this term. So personalized prevention aims to prevent onset, progression, and recurrence of disease, and or through the adoption of targeted intervention that consider the biological information, environmental and behavioral characteristics, but also the socioeconomic and cultural context of individuals. So again, the discussion about big data importance in order to properly plan the best life trajectory is still, again, relevant, not only for C2PERMED, but also for profit. We also report that this kind of approach should be timely, effective, and equitable in order to maintain the best possible balance in lifetime health trajectory. So this is our working definition. Next slide, please. The objective of profit are reported in a very concise manner in this slide. So first of all, we want to foster collaboration among all the stakeholders interested in personalized prevention. We aim to raise awareness on the importance of creating also strong and collaborative relationships, have a full understanding thanks to a large mapping exercise on the research advancements in personalized prevention, then understanding the effectiveness, the clinical utility, but also the success factors and the current gap and challenges of the approach in personalized prevention. Then supporting, thanks to all these activities, then the public health authority in order to strengthen their capacity in designing, accessing, and implementing personalized preventive approach. And lastly, raising awareness among citizens, patients, but again, also, different stakeholders like healthcare professionals on personalized prevention with the final goal to improve the quality of life and health outcomes. Next slide, please. How to reach the objectives reported? We have a quite clear methodology in place that started already from a large mapping exercise, and now we are moving to the assessment phase with the definition of the elements of the profit framework, and then we expect at the end of by the end of the project also to build a number of action and activities and intervention. As a cross-cutting team, there is a continuous stakeholder engagement activities in order to feed a strategic research and innovation agenda that will be delivered, as I told you before, by September 2024. So I will now move into more closer details of what we have done in the first year of activities, specifically concerning the mapping phase and some flavor of the assessment phase that is still now ongoing. Next slide, please. So, according to the overall goal of the project, we aim to spend the first year and a half of the project in mapping with the literature reviews and scoping reviews, but also surveys, the current practice and progress in the field of personalized prevention, not only Europe, but also internationally. And I report in the next slide the main results of the first mapping exercise. Next slide, please. So the first approach that already finished, let's say, in terms of outputs, was mapping the ongoing approach starting from 2017 to date on personalized prevention. Of course, we had our working definition, so we defined what we mean for personalized preventive approach, and you can read it by yourself. But we also wanted to map the bottlenecks for implementation, because we think that these are two important elements in order to have our look forward and our strategic research and innovation agenda. If you want to read more about the details of the protocols about this mapping approach exercise, you can go in this link, because we registered our protocol. Next slide, you will see the major output, but there are a lot of details reported in the deliverables that now is under approval from the European Commission, so unfortunately is not available yet for public consultation. But just as a snapshot result, you can see that the mapped approach in personalized prevention that are ongoing internationally are mostly dealing with cancer, but also with cardiovascular disease, are again more commonly in the tertiary prevention, which is about prevention of recurrence, so in people that has already a diagnosis of disease. And again, this is concerning the approach of most of all about pharmacogenomic. Next slide, please. We also mapped at the same time the process and outcome indicators for the evaluation of the clinical utility of personalized prevention approach. Why we did this? Because unfortunately, so far, there's quite a lack of clear evidence of what clinical utility means, because this unfortunately is often cited as one of the most important barriers to the uptake of personalized prevention approach. So in order to have an understanding of what the clinical utility means and which are the indicators used to define the clinical utility, we made an extensive scoping review. The results are reported very concisely in the next slide. But again, all this stuff is reported in deliverable now under evaluation from European Commission. And in order to have an understanding of what I told you, we collected 57 formal assessment published of genetic tests, genomic or other omic approach only in the field of prevention. As you can see from this chart, we realized that most of the vast majority of the approach published used an health technology assessment approach, but still others have been used. And health technology assessment approach is the one that is most commonly used in the recent years. Next slide report the details. Oh, sorry, there's something not working here. Okay, right. Okay, so when we extracted all the dimensions of clinical utility that have been used in the different assessment published, we realized, as expected, that not all the dimensions have been used in all the assessments. So there is a huge heterogeneity, okay, in terms of the indicators used to assess the clinical utility of the different personalized preventive approach that we mapped. So we are still reasoning about that and writing a manuscript in order for the scientific community to read our reports. As you can see, economic impact is quite commonly addressed, as well as the clinical validity and also, of course, health outcomes, but others are very much underrepresented. Next slide, please. So you can see, and we will be able, hopefully, to participate to an event that we are aiming to organize in March as one of the first output of Prophet open to all the scientific community, where all the details of the mapping exercise that will finish by the end of February will be presented. So please save the date and in order to participate, please. Next slide, please. So we are now moving to a new phase of the project, Prophet project, which is the assessment. What does it mean? The consortium now is entitled to build up a framework, the so-called Prophet framework. The next slide will detail how we are going to work in this endeavor. Because we are building a framework that in principle should contain all the major elements from the evaluation using the health technology assessment framework of genomic technology, moving to forecasting the potential health impact in terms of the population health thanks to a policy introduced that can use a policy intervention where a genomic technology is supposed to be used for fostering personalized prevention, and then monitoring also the impact of such policy introduction over the years. So this is the ideal Prophet framework we want to develop across the lifespan of the project, but there is still an ongoing discussion with our partners. So this is like not a definite slide about that. The next slide will tell you something more in terms of details about how we are gonna work in order to construct and also validate the Prophet framework. And now this activity is led by INSA from Portugal, and we are going to work on specific tests, the hydropyrimidine dehydrogenase, which is a pharmacogenomic test, for which already there are strong recommendations to be used in clinical setting, and so there is a sort of policy recommendation also to introduce in the healthcare system. So we are going to use this example in order to validate our Prophet framework. So the work is still very much ongoing, so the details will be very likely presented in the webinar of March that I mentioned earlier. Next slide, please. The Prophet building activities didn't start yet, and will benefit, of course, from the profit framework definition and also the validation with 3 case study. And because after that, we will build up for different action plans in 4 European different countries. So if you have questions or other comments or remarks, please refer to me and to the partners of project for further details, because again, for the sake of time, I cannot go too much into that. Next slide, please. So all these activities are aimed at define a strategic research and innovation agenda, okay? The SRIA will be delivered as a first draft by the end of the next year, a bit earlier on September, and will benefit not only from the mapping exercise and the assessment phase, but also to the stakeholder engagement, and will feed and will comment our mapping results, and will feed with the review what we will report in our strategic research and innovation agenda. A first, let's say, flavor of our vision that will feed the SRIA is present in the concept paper of profit that has been now also published on our website, and that will be presented from my colleague Stefan in few minutes, I guess. This is the first step that has been completed, the delivery of a concept document about personalized prevention, while, as I told you before, the other steps are expected in the coming years. Next slide, please. So I think we cannot go too much into details about that. I will skip this slide, please. Just to tell you that in order to be involved, if people attending this webinar or friends, colleagues, you know, want to be involved in profit as a stakeholder, as experts, in order to provide input in the development of the SRIA that will represent our roadmap of personalized prevention delivered to the European Commission, you can go on our website in order to contribute to the second phase, third or fourth one, because the first one is already concluded, but it was not open to the external scientific community, and will be presented from Stefan in a second. I think the next slide just reports to the website, so you can go there, you can register as a stakeholder if you wish, you can read also our main output of the first year. A lot of the output are not ready available for the public consultation. Next slide, please, but you can still follow us on social, like this event, you can register and be more active. Thank you very much for your attention.
Thanks a lot, Stefania. Here also a lot of information, because a lot of activity has already been going on. So great to see all these results and the upcoming activities, and that the different experts will be able to join, especially through this stakeholder profit forum. So I invite now Stefan Swartling from Karolinska Institute in Sweden, who is partner of the Profit Project, and who will present us the concept paper, which has just been launched. So this is the news of the news. So the concept paper on personalized prevention towards the European roadmap, presentation, interactive discussion. So Stefan, the floor is yours.
Thank you, Eva, and good afternoon and good evening, colleagues. So Stefania, we are all called Stefania and Stefan in this project. Stefania presented the profit concept, and this is one of the outputs of the first year, where we have charted a concept note towards delivering the research and innovation agenda. Next slide, please. Now, life for many of us begin as healthy, but over time we develop some risk factors, and then most of us become sick before we finally die. And the question here, as you can see in the green and the red arrows, how do countries in the European Union spend their health budgets across the continuum of healthy, risk, and sick? Well, it appears that 97% of our healthcare budget is spent on care, or tertiary prevention in previous language, but only 3% on preventing a disease. And if you click again, please. Yet WHO in Europe estimates that we could actually prevent or delay 80% of heart disease, 80% of stroke, 80% of type 2 diabetes, and at least 1/3 of cancer cases. So there seems to be a very good argument for prevention. Next slide, please. We also have an aging population in Europe, just as you do in China. And we are getting older and older. And when you get older, care costs more money. And actually taking care of us, not just medically, but also in terms of social care and nursing homes, is very expensive. So the question is, what can government do in our countries then? Well, we can, of course, think about measuring, increasing the productivity in the healthcare sector to meet the rising demand. But that is typically quite difficult. Our nurses are already very tired and working quite hard. We can increase retirement age, and that is already happening in many European countries. So we work longer and we pay taxes longer to the system. We can pay more taxes as well. But then in the orange is the value proposition we want to make, that we can also delay the disease onset so that we will get the disease. Maybe you will get the same cardiovascular disease, but if you get it 5 years later, maybe you will still get cancer, but what if you get it 7 years later? And that's where prevention comes in, and health promotion, and the value proposition for profit is, can we do this in better way with more precision? Next slide, please. We wanted to illustrate this also by saying what causes premature mortality, which is in this case here is before 70 years of age. Well, 10% of premature mortality was due to healthcare or lack of good healthcare in this case series. 20% due to environmental social factors, 30% to genetics, but a whole 40% were actually related to lifestyle or life condition, because many people don't necessarily choose how to live. It's dictated by the conditions under which they live. So we just handed out the Nobel Prize last week or on Sunday, as you may have followed. And typically the Nobel Prizes for medicine, which are selected at Karolinska Institute at my university in Sweden, are given for advances in medical care. And this year for the mRNA technology. But maybe with time, and click please, Eva, we can hope to have a Nobel Prize for interventions that change the life condition and the lifestyle. Wouldn't that be fantastic? The big gains. Next slide, please. Stefania has already given you the working definition from the profit concept, but let me repeat it. Personalized prevention aims to prevent the onset, the progression, and the recurrence of disease through the adoption of targeted interventions that consider biological information, environmental information, and behavioral characteristics, as well as the socioeconomic and cultural context of individuals. This should be timely, effective, and equitable to maintain the best possible balance in lifetime health trajectory. So that's a long sentence. But I want to take away, next slide, that there are 3 levels of data that we want here circled in yellow. There is the genomics and the biomarker level that we heard a lot about today, but there is also the individual behavior. How do I eat? How do I move? Do I smoke or not? And then there's the environmental and social level. Postcode is a very important predictor of disease and death in many European countries, maybe in China too, which is about the socioeconomic environment in which you live. So 3 levels of data. Next slide, please. We, as Stefania also showed, did proceed to map the genomics and the omics types of biomarker level, though. And we found that a whole lot of them were actually genetic risk predictors that could potentially be used for stratification, for primary or secondary prevention. This typically means that there is an association between a certain biomarker and a certain cancer or another disease, but not necessarily that they are integrated in any useful care pathway and can be used for medical care. Next slide. This is a repeat of Stefania's slide, showing that most of the health system strategies that are actually where markers and genetic material are incorporated in health system strategies are for treatment, tertiary prevention. And most of it is for cancer treatment, but also some for cardiovascular disease treatment. So in many ways, the state of the implementation is still precision medicine for treating cancer. And that is, of course, fantastic. But it means that we have a whole agenda left to implement and a large prevention dividend through precision to harness. Next. We also did a literature review, and I and colleagues actually interviewed a lot of stakeholders, 200 of them, across the European Union on barriers to adopt personalized prevention, on strategies to adopt personalized prevention using our definition. And I've highlighted some of the findings here in big letters. And one of them that came out was the health systems for now are fully geared towards care and not towards prevention or health promotion. Second bullet, that awareness and understanding of personalized prevention are actually low across all stakeholder groups. And stakeholders here of healthcare financiers, healthcare providers, even patient organizations, the industry, etc. So generally, people and stakeholders don't know the prospects here or personalized prevention. Then thirdly, we see that we have a lack of basic as well as continued lifelong training for health professionals and policymakers in prevention and any prevention and personalized prevention. So we don't train staff or people, citizens, or even patients well enough to be able to actually use the available knowledge. And then fourthly, we have a lot of promising markers and associations, but we have insufficient evidence actually of the cost effectiveness of using this or to actually put this into practice in medical care. Next. You remember our conceptual model with the 3 levels of data, the genomics, the individual behavior, and the societal. Let me now remodel them in the next slide, please. Because if you look at across the left now, the y-axis, you see we have the biomarker level, we have the individual level characteristics, and we have the environmental level of characteristics and data. And across the x-axis, we now have the illness course from healthy, risk, sick, across concepts like health promotion, primary prevention, secondary prevention, and then treatment. And what, as you may recall, click please, a lot of the current application is in precision medicine and in cancer care, which means we have patients in hospitals who are sick, and we have a lot of healthcare data that we use, and we strengthen this with biomarkers and various genetic and omics analysis. But the challenge now for us, if we want to realize the personalized prevention dividend, is to move to the left in this figure, where you can no longer talk about a patient. You are talking about citizens living their lives. Click, please. And then you have different types of challenges in terms of getting access to data to be able to realize the prevention agenda among citizens and no longer in patients. First click, please, Eva. For one, if we now know my socioeconomic data, we know my lifestyle data, or maybe my telephone knows my lifestyle data, and you can maybe know some of my biomarkers, how can we collect and integrate this type of data to do something meaningful with it to predict the risk that I, Stefan, have for disease or illness? Next click, please. How should I trust you to share this data? Because my phone may know a lot about me, but why should I give this data to you? And after all, what is the ethics of collecting all of this data, and what do you use it for? Next click, please. How can we engage people like me, people like in communities, to actually collect this type of data and share it? For instance, the food environment, how food is being advertised and sold around us. How can we actually collect information around that? Presumably, we will need to engage communities and citizens, be it to collect such data or to share their data. Next click, please. Given that prevention is about the food environment, it's about the physical environment. Can I walk safely? Is there a bicycle lane, etc.? What do I learn in school, etc.? And to some extent about healthcare. It's also a governance problem. There's a question of multi-sectoral governance between the education sector, the roads department, the ones who regulate food, the ones who work on the air quality, etc. How do we get these sectors to work together for a better prevention? And that is a governance issue in multi-sectoral collaboration, which is typically very difficult to do, but where some cities are actually ahead generally of national level data, because mayors seem to be in a better situation to integrate across sectors than what prime ministers are. Next, please. Then there are a number of cross-cutting issues, of course. The equity aspect. How can we address differential risk for disease between different population groups? And typically, as you know, poor people have a higher risk for a lot of things, and they can also be least able to afford these type of technologies and healthcare, which is a challenge that we must address to make sure that these gains are actually available to the people who need them most. Then secondly, there's something I call the political economy of prevention. What happens and what doesn't happen? We have known for a long time that smoking is bad, but why is smoking so widespread in China, for instance? Why is the sugar industry not controlled in the European Union, etc.? Why do these important prevention things not happen, or why don't they happen? And that is something that political scientists can study. And I'm sure it will be the same of some of these more predictive genomics and omics technologies. And then finally, there is the whole aspect around communication and media, because once we are in prevention space, we are competing with the experts who advertise food, who advertise drinks, who advertise tobacco in some countries, etc., the commercial determinants of health. And typically, they communicate much better than we public health people do, and they have a lot more resources to communicate about something that is not good for you than we have to communicate about something that is good for you. So that is a space we need to enter into and become better. Next, please. Now, finally here, I wanted to think about the illness course, if you will. Where we need to identify a certain risk. We need to stratify the risk. Is it high? Is it low? We need to personalize the intervention. We need to offer it to someone who should then adhere to this intervention. And this should ideally improve the outcome and have some population impact. And that is the value proposition for personalized prevention here. So what are some of the challenges we see here across this continuum? Click, please. Well, one we already saw in Stefania's and repeated by me presentations here, that biomarkers are unbalanced between disease groups. They are primarily for cancer, and some of them are for cardiovascular disease so far. Secondly, that also we don't know the value of this information in health system strategies to predict, manage, and improve outcome, and whether this can be cost effective or not. So we have a lot of work to do there. We also have a lot of research questions I would propose for a research and innovation agenda. Click, please. For instance, how do we identify risk in citizens going about their lives? People who are not in hospital, they are not patients, but yet they carry around a lot of risk. How can we use social media to approach them? Can we actually use wearable technology, including mobile phones and funny watches? Can we go to a supermarket? Can we go to a club? Can we go to a park and find them and identify risk? Click again, please. How can we actually then integrate data across biomarkers, across lifestyle, across socioeconomic conditions to actually predict the risk? So far, we are typically consider one risk at a time, and we are doing this manually. We found in the literature. We have not yet applied artificial intelligence to integrate these data sources and risk assessments for multiple risks at a time. So there seems to be a research and innovation potential. Next, please. We have not yet really personalized the offers of preventive messages. We still give the same preventive message and intervention to everyone. And then the question is, how can you personalize a proposal to me, Stefan, that I'm likely to adhere to more than a generic message? And how can you actually nudge me to adhere to this? Can you use social media? Can you program my wearable? Can you talk to my wife so she nudges me, etc.? How can you strengthen me in my socioeconomic condition? And how can you strengthen the trust I have in you as a provider or whatever, so that I actually follow this advice and actually exercise more or eat better and take the medicine or all of those things that we know we should be doing, but we don't necessarily do. And then click again, please. And then finally, how feasible is it to do this in existing cities, in existing societies, in existing health systems? What's the cost of it? And how much does it improve the outcome? And here, as we alluded to in the last slide, is also a question about how can we train our healthcare staff to be able to do this in a smarter and better way. We may have better technologies, but how will they be able to use them and consider that risk in context of the person's living situation and lifestyle? Next, please. This all needs to be embedded in health systems for it to happen. And this is the WHO model of the health system building blocks, which does have, as you can see, one building block called medicines and technologies, where we can think that the new gene test will fit. But obviously, the human resources, the health workers here, need to be able to interpret and understand and use that. The information building block is of course very crucial, because we have a lot of information, socioeconomic, individual, wearable, and the bioinformatics, the biomarkers. How does all this get incorporated and managed in a way that people can trust and provide something meaningful. Then how do we pay for this? Typically, as I showed you in the beginning, we don't like to pay for prevention in healthcare systems. Can we find ways to make preventive proven technologies actually reimbursable, or build financial incentives for providers as well as individuals to follow that advice? How do we govern this in the health system and across sectors? And then finally, how does this change service delivery? And this interpretation and this integration of the new findings into existing health systems is a big area for health systems researchers and requires a lot of different types of expertise to collaborate. Finally, next slide, please. If you found this interesting, please go to this website here on the Prophet website and download these concept notes. And please be in touch so that we actually get to share your ideas. Because over the next 1 year, as Stefania said, we want to turn the concept note into a research and innovation agenda. And I hope we can all own the problems and the questions we put in the research and innovation agenda and collaborate to answer that, to really realize the potential of prevention and increase the precision in prevention, from giving the same advice to everyone to actually assessing risk in context and delivering personalized intervention and messages and following them up, so that we actually don't live forever, but we live healthy for a longer time before we eventually get disease and die. So thank you. And Eva, back to you.
Thanks a lot, Stefan. Very informative, a lot of questions raised. And I know there are a lot of questions that you're trying to answer in the concept paper. So another reminder for the audience to download the document that's available on the Prophet website. Thanks a lot. I'm opening now to question and answers to the speakers we had in the third session. I have not yet seen any questions in the chat, but please feel free to use it or to speak up now. And what is really great to see is that there's already some cooperation going on in the chat. So I see people exchanging contacts, so that's very nice. And yes, we will make slides available if all speakers agree after the workshop, of course. Are there any questions specifically to the speakers we had in the last session? Okay, for the moment, I don't see anything.
Can I ask the Chinese audience here, how long do you think should it be our role to come up with better cure for cancer of the lung, as long as people are allowed to keep smoking? Or what should we do to prevent smoking in better ways and not just managing the disease? That's my question to the audience here.
So how to prevent people from smoking, making sure they stay healthy. Okay, I see a hand raised from Francesco Florini. Would you like to answer or to give a comment here?
No, I have another question, so I'll let the Chinese colleagues answer.
Oh, okay, sorry. I thought it was a reaction. Okay, yes. Is there anyone from China who would like to answer or to just give a comment? Of course, it's all individual comments we are having here. Feel free to speak. We have the translator who's still with us. And of course, also you can use the chat if you wish to reply in written format. But Stefan, you're raising difficult questions, you see. Maybe there's not a quick answer to that.
It's hard. It's hard.
Yes. Would you like to speak up? I see someone.
I think compared to let's talk about cigarette price. I think it's a good way to increase the cigarette tax. That probably can prevent people to smoking. But currently in China, the cigarette price is not high enough to prevent people to smoke.
Okay, thank you very much for this comment. That's certainly something that's been done in other parts of the world as well. Stefan, would you like to reply?
No, thank you. I agree with that. And I've also followed very interesting proposals from some countries where they put an age limit for buying tobacco. And they say, if you are born after 2010, you will never be allowed to buy tobacco. So they are actually hoping to create tobacco-free generations by banning tobacco sale to people who are born after a certain date.
Okay.
Now,
I see also a comment in the
I
chat
think
from...
I just wanted to challenge the auditorium, not just to think and wait for people to get sick, but actually to think actively about prevention. And that certainly applies particularly to foodstuffs as well. We're almost all getting diabetes, as you know. What can we do to prevent diabetes at the food level, at the food environment level, much as we need to manage it better? Okay, thank you.
Thank you, Stefan. There's also a comment from Australia or regarding Australia and New Zealand in the chat you would like to see maybe. So then, Francesco, yeah, you had another comment or another question, please.
Thank you very much, Eva. Thanks for the presentation. It's always inspiring to hear the Prophet consortium. So my question is this. I work for Thermo Fisher Scientific, so we're a technology provider. The technology is there, but as usual, the policy and legislations are falling behind. What would be the first, if you had to pick one policy action to implement in your country, so it doesn't have to be a European-wide area until we amend the EU treaties. So which would be the policy action that's most urgent to make, for example, genomics an integral part of the preventive strategy?
Stefania, would you like to start?
Hi, Francesco. Thank you for your question. As you might know, there is an ongoing project funded by the European Commission, which is CANIL, that is trying to develop evidence-based recommendation in order to foster the implementation of some potential preventive genome-based technologies like polygenic risk score for the breast cancer prevention. So along the development of this project, just to give an example, we aim to release recommendations that are directed also to policymakers in order to foster the implementation of these technologies into the current screening programs. Of course, in order to release this recommendation, we are collecting evidences. We believe the recommendation should be evidence-based, as usual. So in my knowledge, there are certainly, not in the field of primary or secondary prevention, but certainly in tertiary prevention, there are a plethora of potential pharmacogenomic applications that should be at the forefront attention of policymakers to really implement more widely. But unfortunately, this depends also on the technologies available in different European member states. So there are some member states that do not have the capacity in the cancer center to make this as a routine. Even in the metastatic cancer, where there is already guideline in place to do this kind of pharmacogenomic testing. So I have not, let's say, a unique answer to your question. I have more hopes, let's say, but I'm working hard in order to make these hopes being not only remaining as a hope.
Well, can Stefan add, with my researcher hat on, I would also like an evaluation of these technologies so that we can show their relative cost effectiveness, and we can actually show that they improve outcomes, so that they are not just technological innovations, but they actually make people live longer and healthier. So that is an evaluation policy I would put in place to demonstrate the value of these and to keep demonstrating the value as they get better and better. Over.
Thank you very much, Stefania and Stefan, for your remarks and answers to this question. Is there any other question or comment someone would like to raise?
I want to underline that Francesco is one of the advisory board members and stakeholder, very active in Prophet. So it's very important for us to have people like Francesco that can give us a suggestion and inputs in order to properly feed our SRIA. we will start a consultation more structured in March, okay? But so please join this group because so far it's not so big, okay? So thank you, Francesco, for your question.
Okay, thank you very much. So then I think it's time for me to wrap up. We're reaching the end of the webinar. So thanks again to all the speakers and our experts who have joined us today and provided so many interesting insights. Thanks to the whole audience. I'm making it short because I see that time is running, but I think we have seen that really personalized medicine is part of important strategies both in Europe and in China and certainly in other parts of the world. So international cooperation in the field is certainly of importance, and we've seen specifically also on prevention that obviously we might need to have a shift from treatment to prevention, and especially on targeted prevention. We've seen that there's a lot of activity going on. A lot of initiatives are running and are running also in the longer term. So we can hopefully expect them to be sustainable on the long term. Many of them also offer opportunities to become involved in some way. So a lot of strategic documents are available, which are open for consultation. You have seen that in the different slides, and I'm sure that they're searchable through the different websites. A lot of links are also shared in the chat as well. But there's also a lot of infrastructure that's actually developed and partly piloted, partly already in place. Very nice facilities which have been shared through the different experts. So we can hope that yeah, we will reach some more personalized action in the future, and I welcome you all to be involved in these initiatives, to comment in the different fora, to be part of the different stakeholder groups, because this is where you will be able to share your opinions and your experiences. So as Stefania just said in Profit, there is also the forum, which is open to stakeholders from any kind of background interested in personalized prevention. You can find the information on that on the Profit website. And as I had mentioned in the very beginning, in the Enriched Global Health Innovation community, we are very happy to welcome new members, and we will have this new platform ready for you very soon, and keep you informed about the different features we're offering and the activities we're offering. Thanks a lot to the 3 initiatives which have coordinated this meeting. Thanks a lot to the speakers, and I wish you a very nice afternoon or evening, whatever is left for you. Thank you.
Thank you.